Hi guys, hi, hello from Club Safari. We're talking about our expose continues. I promised you I'm gonna make a little video about the Chinese hospitals and Chinese doctors, Chinese medical care in general. I see that our buddy, Mr. Motorcycle Mechanic, has been totally understating or underestimating you know, how dire is the situation in China, medically speaking. It's horrific. It's totally fucking horrific. But Mr. Winston and his buddy C Milk, oh, you gotta be a little bit careful. There's a little problem here and there. Woof, 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 woof. What the fuck? Wait, talking about being careful. I'm going up the stairs here. I'm going to sit at the top of my balcony overlooking some trees and shit in the background there. Let me sit here for a moment. Okay, so what if I tell you that the head, the chief of China Drug Administration or China Drug Agency, that is somebody that's the equivalent of, let's say, the Surgeon General of the USA. Surgeon General of the USA got executed. Bullet in the back of the head. Thank you for coming. Here is your fucking bullet, and kneel down and on a sandbag and okay, well, I don't know. To be honest, I'm not sure how he was executed. Probably was a bullet in the back of the head or maybe whatever. So imagine that. The Surgeon General of the USA gets executed. Okay? The equivalent in China now of the Surgeon General. Why? Why would you want to fucking execute your Surgeon General? Huh? Isn't that fucking a little bit serious? Oh, very simple. Corruption. Corruption. The age-old problem of China. From the top right down to the bottom. From the bottom right up to the top. Corruption everywhere. Medicine in China is fucking totally corrupt. Totally. The hospitals, the doctors, the nurses, the medics, the medicine itself, the research, the fucking Surgeon General, totally 100% corrupt. He got a fucking bullet, okay? But Winston is telling you, oh, there's a little problem here and there. Guys, I'm not knocking Winston on his, you know, zipping around on his motorbike and you guys watching him, you know, that's fine. But please don't take it with a large, you know, bag of salt. What he's saying, what he's telling you. He has his little agenda, you know, but, oh, I don't want to be political. I don't want to, woof, 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 woof. But he's not even talking a half a percentage of the truth of how dreadful it is in the situation in China, you know, like, oh, I have to apologize. I don't want to be negative. The guy's a comedian. He should follow our buddy there in the US, the South African there, but became world famous now, the comedian there, you know. Maybe that's his goal. Maybe that's his goal. Maybe, you know, he's unintentionally funny. Anyway, so let me tell you, I'm going to tell you now the fucking real situation. I, myself, okay, have experienced the fucking horrors, the bullshit, the politics, the corruption, the fucking cheating, the lying, the thieving, the black fucking mail going on in Chinese hospitals, dude. It is fucking totally horrendous, okay? And you cannot cover it up like Winston and C Milk. Bull fucking shit. You guys just have no fucking clue. Seriously, you are clueless. Okay, I already told you that the Surgeon General of China was executed, right? The government, the police, the China police have ordered hospitals in China. If you have a certain number of beds, like a certain size, like 1,000 or 2,000 beds, you have to employ at least 100 security guards. That's minimum. 100 security guards. This is not a casino. This is a fucking hospital. The police, the government has sent in police to guard hospitals. Why? Guard hospitals from what? Thieves? Criminals? No. Every single fucking year in China, tens of thousands of doctors or medical personnel are attacked. God knows how many are murdered. I don't know, plenty. Murdered inside the fucking hospital. People, doctors are getting killed, attacked. It's calculated that 1 in 7 Chinese doctors have been physically assaulted. 1 in 7. God knows how many are killed. They have to send the police to guard hospitals, to guard doctors. Now, what the fuck is going on? What is going on? Why would you want to kill your own doctor? I mean, have you thought it, or just assault him? You know? Okay, I have actually tried to assault. I've actually tried. I probably would have come very close to kill a doctor myself in Taiwan. Taiwan is very similar to China, actually. Very, very similar. It's better, but it's in many ways it's the same. I will tell you that in shortly. Okay, now why the fuck would people want to kill their own doctors, nurses, etc.? And why are they killing them? Because corruption. Imagine you go and see a doctor. Now you have to fucking line up. Like everything in China involves lining up. Hours. Days. To buy a fucking simple train ticket. You can be lined up for 2 days. People take a sleeping mat to the train station so that they can sleep in line. So what happens when you have all this fucking long lines, all these long queues? Corruption. Scalpers. People come up to you, hey, okay, we can, this is, yes, because you know, if a system works on numbers, then they will sell a number to you. Everywhere in China, you have this shit. Scalpers, right? Now you pay fucking, now imagine these people are poor. They go to a government hospital, they lined up for hours, for God knows how long. Now a scalper comes up. Oh, you give me wah wah wah, and then I will help you to quickly see the doctor. And then the guy disappears. I mean, anywhere you go in China, you have these fucking scams galore. Don't depend on Mr. Winston and his buddies to fucking tell you about this, because they have no clue. They are fucking clueless. Okay? Now, this is just the start of it. Now, when you get to see the fucking doctor, he's corrupt. He gets very low salary. To be a doctor in China is not a profession like in the rest of the world. So, okay, let me tell you another fact. The world's number one richest doctor in the world, and the richest man in Los Angeles, USA. The second richest man in Los Angeles is another South African, Elon Musk. The richest South African in the US, in Los Angeles, is a fucking doctor from South Africa. Okay, just go and check that. World's richest doctor, South African. Now, in China, it's the opposite. You're a doctor, you're screwed. You get crumbs. So what does that do? Encourage corruption. When you see a patient, all you care about is to fucking clean out his wallet. Okay, just like when you go on holiday to Thailand, is to clean out your wallet, right? So when you get to the doctor, he doesn't give a shit. You know, maybe you go there for a little headache or whatever. Oh, you're gonna have a heart transplant. Literally, thousands of people go for are recommended serious medical procedures that wipes them out financially, and then it was totally unnecessary. That includes many foreigners. Okay, in fact, two foreign friends that I know very, very, very well have both died. They were my neighbors in one little alley where I lived in fucking Shenzhen, where Mr. Winston lives, in Shekou, the foreign ghetto. Both have died. They went into hospital and they never came out. One dude, American, in his early 30s, young wife, young baby. The other guy, a British guy. We worked together for years, teaching English. His father was totally shocked. He was also younger than me. So if you think this is a fucking joke, I personally know two foreigners, neighbors, who have died in Chinese hospitals like that. Okay? Now but I don't want to speculate why they died. I had fake drugs in China. Fake drugs, fake medicine is a huge fucking industry in China. Huge. Fake booze, I told you yesterday, 50%, up to 50% is fake. Medicines, oh my God. Oh, I was once, a few years ago, I had a serious cough, a serious throat, chest infection. You know, the pollution in China is just fucking killer. Millions of Chinese die from the pollution. Now, you couple that with the fucking fake medicine and the shitty doctors and the lying, cheating, thieving doctors. It's no wonder millions of Chinese are dying every year just from pollution. Breathing in polluted air. Now, I was walking around for months, in and out like a fucking yo-yo, in and out of the local little hospital, drugs, drips, drugs, drips. 3-4 months, I was coughing like a fucking dog. Nothing worked. Nothing. When I took my holiday to here in the Philippines, where I am right now, I went to the local doctor in this little tiny town in the fucking jungle. I walked in there and I told the story to this lovely lady, doctor. Oh, okay, she gave me a prescription, go to the pharmacy around the corner there. This is a tiny town here in the jungle, in the fucking jungle in Mindanao, in the Philippines, okay? First of all, the doctor didn't want any money of me, to see me, to give me nothing, zero, free. I went to the pharmacy, I got the medicine, 4 days, 4 fucking days later, I was clear as a bell. 4 months in China, being bombarded. What does that tell you? Fake fucking medicine. Galore. China is now exporting fake medicine all over the world, killing millions of people all over the fucking world. You're taking a medicine. Let's say you have heart medicine, malaria, any fucking medicine. Even Viagra. Okay, so what did the Chinese do? Oh, okay, we're going to make money. So instead of putting like 100% of the ingredient that's needed, let's say for Viagra, let's take that as an example. Oh, we're going to cut it to 50% of the active ingredient. Then we save 50% of the money, right? That's the logic. But now, of course, then the next guy opens up his fake factory. Remember in China, everything gets copied to death. You open a fake Viagra factory, within weeks, there's going to be hundreds, thousands, tens of thousands of people doing fake Viagra. So the next guy is going to say, oh, he's selling 50% of the ingredient. I'm going to do 49%. Then the other guy goes, I'll do 48%. Because that little bit is going to be your profit. And then you end up at fucking 10%. Then you end up at zero. That you take drugs that have zero effect. Killing people. That's how the fucking drug czar of China got a bullet. People were dying. I mean, it's fucking unbelievable. Unfucking believable, okay? I walked into, and then, okay, and then of course the doctors, they are just, I don't know if they have any education. Like, you know, you can buy anything in China, degrees, any fucking thing, right? I suspect most of these doctors have actually no real education. They just sit there and then they have what I call the shotgun approach to treating you. Shotgun, you know, load. I went to a little hospital in Taipei, okay? I had fucking sunburn, my head. I got drunk and I don't know, I was standing in the sun or fell asleep, I think, in the sun. Got heavy sunburn on my head. You know, when you have sunburn, it's fucking painful, right? In the middle of the night, I couldn't stand it anymore. I got on my motorbike, I drove down the mountain. I lived up in Yamisan in Taipei, and I drove down to the nearest little hospital. There were 3 or 4 people in front of me. It was like midnight, waiting to see the doctor. He was still on duty. So I was sitting there. You know, in China and Taiwan, it's just like open area. You know, you sit on a bench. You sit there, boom, 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 and then the doctor is sitting over there, you know, there, and you can overhear exactly. You can see over here. There's no partition. There is no privacy in China when it comes to medical. If he says to you, oh, well, let me think about this. Probably if he wants you to take your pants down or bend over the desk, maybe there may be a curtain. A little curtain will be pulled over, but that's it. So anyway, let me try and remember now. The first person had some fucking cough. Okay, so the doctor was like, he just sat there behind his desk. He never moved, like a fat fucking slug. And he was like, okay, he listened to the guy and he's like, okay, he wrote down a prescription. A nurse came in, right there in front of us. She prepared like a fucking whole rainbow color of drugs, you know, like medicines. Pink and green and yellow and da-da-da-da-da. I counted about 7 or 8 different pills going into one bag. There you go. Next dude had a fucking bike crash. So he was like holding his leg, he was split cripple. The doctor didn't get out of his fucking chair, nothing. He just like, okay, prescription. The nurse prepared exactly the same. I was watching her from the same container. She took the drugs into the bag. The guy's out of the door. Third guy had some kind of, I don't know what the fuck was his problem. Anyway, same result. Now it was my turn. I have sun fucking burn. Remember this. I'm in pain, in agony. The doctor looks at me. Oh, okay. Prescription. Gave it to the nurse. She started picking out the fucking pills. I said to her, stop. Tingisha. I told that doctor, listen, dude. Don't fucking bullshit me, okay? What the fuck are you doing? I asked him directly. And then he got really angry. What? I'm a doctor. Are you questioning me? How dare you question me? I studied in the US and blah, blah, blah. Man, I fucking lost it. Lost it totally. I grabbed my... I'm just like, you fucking piece of fucking shit. I'm gonna fucking kill you. I grabbed my motorcycle helmet. I rushed around the desk. I tried to smack him. But he was, I must say, for his size, he was fucking... Well, maybe the fear of God in him. He jumped out of that chair and fucking ran. And I was chasing him, huh? He ran through a doorway, and then he slammed it behind. I fucking smashed that door. I kicked that fucking door and smashed it with my motorcycle helmet. Luckily, it was a sturdy door. 3 or 4 nurses and medics and people came rushing up to me. Oh, cool down, sir. Oh, calm down, calm down. You know, sit down, why the fuck is... I said, I'm gonna fucking kill that cunt. I'm gonna fucking kill him. What's wrong, sir? So I explained to them, and they were like, oh, yeah, you're right. How can he give you... You can't take pills and antibiotics. That's all these things that they are giving out are antibiotics. Anti-fucking-biotics for sunburn. And they're like, okay, wait a moment. You know, she ran off. She came back with Vaseline gauze, which is exactly what you want. You just want to wrap it and cool it down the skin, right? And that doctor never ever came out of his fucking office. While I was there, surrounded by these nurses, they were very nice and kind to me, gave me what I needed, and treated me well. And he never came out of his fucking office. Good thing for him. Now, I fully understand why tens of thousands of doctors in China gets fucking assaulted and murdered, because I was that fucking close. If I just could get my hands on that fucking dude, probably, you know, he would have had to go to a fucking much bigger hospital for a long fucking time. I mean, it was that close. Anyway, but I mean, I can tell you a fucking whole garrison of arsenal of fucking stories. Arsenal, you know, like another time I was in Shenzhen, where Mr. Winston is. Oh, I'm a teacher of doctors. You're talking shit, dude. You teach them some fucking simple phrases. You have no fucking clue. So anyway, you know, over the years I've broken my leg, and I've cracked my leg, cracked my knee. You know, I was on crutches probably 30, 40, 50 times in my life with my legs. I had so many injuries. And I had another injury. I can't remember. Maybe it was. I can't remember what it was. But I was kind of unsure if it was a broken bone, or if it was fractured, or maybe dislocated, or what it was. Right. So I had a crutch, one crutch. So. I went down there was a little private hospital down the alley, maybe 100 meters away. And so I hobbled to this fucking hospital. Went upstairs, there's a fucking doctor sitting there. I told him in Chinese, 我要 X 光，我不知道我的脚有骨头断掉了没有，所以我就要你给我 X 光。You just let me fucking do an X-ray because I'm not sure the bone is broken or not, or dislocated. So I just want an X-ray. That's it. I made it because I know Chinese doctors, I know Chinese hospitals, I know the fucking lying, cheating scumbags, what they are. So I told him clearly what I want. I want a fucking X-ray, okay? So he's like, okay. Oh, 没问题，我懂，你跟那个护士跟他一起去。So this nurse came in, and then and I'm hobbling after her. We came into a little room, And she asked me, and then and I looked around, and there was like a fucking weird machine on the desk. And she's called me, and she said, sit down here and look into this eyepiece. So I'm like, what the fuck? My ankle, my fucking leg. No. Okay. So then I'm like, looking into this eyepiece, and I see fuck all, and there was like a flash. Then she said, okay, you lie down on the bed. I'm like, X-quang, where's the X-ray? No. 医生要先告诉我要先做这个的. Okay, you first do this. So, okay. I lie down on she made me lie down on my stomach, on the bed. Next moment, she put something on my back, you know, and I'm like, what the fuck? And it's like a scanner. She puts a scanner on my back. Then she sat down in front of this machine or computer, with a computer at the desk, and then out comes 2 pieces of paper. She puts it in a big envelope. She gave it to me and said, go back to the doctor. So here I'm shuffling back. But this time I'm getting fucking seriously pissed off. I'm in fucking pain and agony. My leg is swollen up, beating, you know. I'm like, doctor. He's like, okay, no, wait a moment, give me the envelope. He pulls out these 2 pages. One is the fucking big photo of my eyeball, you know, like a huge picture. And he looks at these, studies it, he's like, oh, wait a moment, you know, he pulls out the second one. Oh, this is like my fucking liver and kidneys. Scan of my liver and kidneys. He's like, oh, seems like you may not have a broken bone, but we need to research more. We need to investigate more. I'm like, doctor, stop. Okay, enough. I stood up, I grabbed my crutch, and I tried to hobble to the door. Fucking hell, the next moment, in a rush, I would say about 7 or 8 young guys in medical, you know, suits or fucking whatever, monkey suits,